All right, so it's World Immunisation Week. Of course, we're all concerned about getting the COVID-19 vaccine, but we must not neglect the routine vaccines that are needed to prevent a myriad of childhood illnesses. That's your measles, your mumps, rubella, hepatitis, the rotavirus, illnesses that can be life-threatening. Already the UN Children's Fund, UNICEF, sounded a warning about patchy vaccinations for under 5s in South Africa. It could leave them vulnerable to these diseases. COVID-19 and the lockdown largely to blame for this drop in vaccinations, and it seems we need to fix that. To tell us more, I'm joined by Dr. Gabriele Fontana, Regional Advisor for UNICEF in Eastern and Southern Africa. Doctor, thank you so much for your time. So I would imagine that COVID-19 and the lockdown is the main reason that we've seen a drop in childhood vaccinations. Tell us a little bit more about that and how big the problem is and which areas it's most problematic.
Good evening to you and to everybody following us, and thank you for having me this evening. Immunization programs were facing important challenges even before COVID. In Eastern and Southern Africa, we had a 2.5% increase in the population every year. That means that every year, the number of children that we need to vaccinate increases. And still we have the same resources, the same number of health professionals is expected to vaccinate more children. The result has been an increase in number of immunized children every year. And indeed, last year COVID has come to complicate the situation. Many countries rely on vaccination campaigns to cope with weak health systems and poor routine immunization. And with COVID, campaigns have been delayed or cancelled, and children have been waiting to get their vaccines. Some may get sick, some may die. Now we can prevent that. We now know how to run immunization campaigns safely. More than 1 year into the pandemic, we know how to do it. There is no reason to wait any longer. In 2020 also, it became very difficult to ship vaccines to countries. You may remember, planes were not flying. Even later in the year, flights had become few and far apart. We still managed to deliver 2.1 billion doses of vaccines last year in UNICEF, but it has been very challenging. We know that vaccines are a simple, safe, and most effective way to protect lives of our children. And still 1 in 5 African children do not receive all the necessary vaccines. So we really need to double down the effort to achieve that.
And I understand that you've also looked at the South African picture in a very specific area, Tshwane, Joburg, Cape Town, Durban, among them, and you are seeing a drop there as well. Have you started to see a rise in preventable childhood illnesses that you would normally vaccinate for? And if so, which illnesses are you most concerned about?
Usually, the first thing we're concerned about is measles, because it's a disease that spreads very quickly, and as soon as we lower the frequency of vaccination, or we have pockets of population of children that are not vaccinated, we see outbreaks, we see fatalities. It takes a moment between when you stop vaccinating and you start seeing children getting sick and dying. In some Asian countries where COVID impacted a bit earlier, a few months earlier, and the lockdown started a bit earlier, we calculated around 800,000 children died from preventable causes during last year. We're doing right now a similar assessment for Southern Africa, and the numbers, unfortunately, will be scary. We are talking about reopening economies. Let's at the same time improve access to health services, including immunization.
Could you tell us a little bit more about, a message to parents? I think what happens is that a child might have got a first vaccination but has missed a booster. Is it ever too late to administer that booster? What is your advice for parents who are worried that they've sort of completely lost the schedule of those vaccinations? And how are you going to urge people and local health authorities to assist in getting back on track?
Okay. The vaccination schedule, when you have a first vaccine and then 2 or 3 boosters, depending on the vaccine, that is time to maximize the development of immunity in our body. Still, if you lose one booster, go as soon as you can to your pediatrician, to your health professional, discuss with them. The sooner you catch up, the better for your child, because the sooner it will be protected. We also have seen a bit of vaccine hesitancy, sometimes linked to the rumors around COVID vaccines that seem to translate in concern about the traditional vaccines. Look, traditional vaccines, we know they're safe. We eradicated smallpox. We are eradicating polio. We have seen the number of children dying of vaccine-preventable diseases going down almost to zero in the continent. And every time we leave the foot from the accelerator in things like measles or other diseases, immediately we see outbreaks coming in. It's so important to protect our little ones and to know that by protecting them, we protect everybody around us. So we all have a role to play. We are encouraging, obviously, we're encouraging governments to come in and sustain the efforts and strengthen their systems. We are encouraging donors in countries that are heavily dependent on donors to ring-fence resources for immunization. But we have politicians, religious leaders, we have celebrities speaking up and encouraging people to get their children vaccinated. The truth is that each one of us, we all have a small or big area of influence. We all can do good about vaccination. We all can spread the news in the same way you are doing today with your program, for which I thank you.